What is birth control? Birth control is a way for people to prevent pregnancy. There are many different ways to do this, including, number 1. Abstinence. This means not having any sexual contact. It is the only method that is 100% effective in preventing pregnancy. Number 2. The hormonal method. This involves using a medication that contains hormones to prevent pregnancy. There are many different types of hormonal birth control, including the pill, the patch, and the shots. Number 3. The barrier method. This involves using a physical barrier to prevent sperm from reaching an egg. The most common type of barrier birth control is the condom. Number 4. The intrauterine device, IUD. This is a small device that is inserted into the uterus. It prevents pregnancy by interfering with the way sperm travel to the egg. Birth control is a very personal decision, and there is no one right method for everyone. It is important to talk to your doctor about your options so that you can choose the best method for you. How do birth control pills prevent pregnancy? The birth control pill is a medication that is taken by mouth to prevent pregnancy. There are 2 types of birth control pills, the combined pill and the mini pill. The combined pill contains 2 hormones, estrogen and progestin, while the mini pill only contains progestin. Following are the 3 ways that the pill works to prevent pregnancy. Number 1. Preventing ovulation. The pill stops women's ovaries from releasing an egg during each monthly cycle, so if there is no fertilized embryo formed in the fallopian tubes, then pregnancy cannot occur. Additionally, it may reduce how well female reproductive organs move toward your uterus due to this medication being active. Number 2. By thickening the cervical mucus. Birth control pills work by thickening the cervical mucus. This makes it more difficult for sperm to penetrate the cervix and reach the egg. In addition, birth control pills do not protect against sexually transmitted infections. For these reasons, it is important to consult with a healthcare provider before starting birth control pills. Number 3. Endometrium. The final way the birth control pill works to prevent pregnancy is by thinning out one's endometrium and making it far more difficult for an already fertilized egg implantation. Without this, no baby can survive in your uterus with all its needs met by nutritious blood from you as well. When does birth control pills start working? It typically takes around 1 to 2 weeks for birth control pills to become effective. However, this time frame can vary depending on the type of pill you are taking and when you start taking it. For example, if you start taking the pill on the first day of your period, it will be immediately effective. However, if you start taking the pill on the 5th day of your period, it will take 5 days for it to become effective. Therefore, it is important to consult with your healthcare provider about when you should start taking your birth control pills in order to ensure that they will be effective when you need them to be. How to use birth control pills. If you have decided to use birth control pills, it is important to understand how they work and what to do if you miss a pill. The first step is to choose the right pill for you. There are many different types of birth control pills, so it is important to talk to your doctor or healthcare provider about which one is best for you. Once you have chosen the pill you want to use, it is important to start taking it on the first day of your period. If you start the pill on any other day, you will need to use a backup method of birth control for the first 7 days. It is also important to take the pill at the same time every day. This will help to make sure that the hormone levels in your body remain constant.